FDA has approved the first drug to treat postpartum depression.
The condition affects more than 400,000 women every year. Dr. Tara Norella has more.
I remember being in that picture.
Stephanie and Adam Hathaway had just moved to China when they became parents for the first time.
She was the same size as Monkey.
Shortly after daughter Hadley was born, Stephanie started sliding into depression.
I had intrusive thoughts. Your husband deserves a better wife. Your children deserve a better mom.
Symptoms of postpartum depression can include sadness, anxiety, irritability, loss of appetite, self-harm, including suicide, and loss of interest in the new baby. After 3 months on antidepressants, Stephanie was feeling more like her old self. When she became pregnant with daughter Brenly, Stephanie went back on medication as a precaution.
How soon after the birth of your second child did you start to feel those same symptoms?
The crying was immediate. It was darker than the first time.
This time, antidepressants didn't help.
Hey, Daddy.
So Stephanie signed up for a clinical trial of a new kind of medicine. Zulresso targets specific brain receptors to rebalance the hormones that spike during pregnancy and plummet after birth. Dr. Samantha Meltzer-Brody at the University of North Carolina led the trials and says fast-acting relief is vital.
The currently available treatments are not going to work for generally a month or more. That's really hard to look at someone and say, I know you're suffering tremendously and we're going to start treatment and maybe a month from now you'll feel better.
The new medicine is a one-time intravenous treatment that requires a 3-night hospital stay. In clinical trials of more than 200 women, 70% had improved mood, appetite, sleep, and functioning. Stephanie felt better on her very first day.
Between hours 12 and 18, I noticed a huge difference. Those intrusive thoughts I told you about were gone, and they never came back.
Women in the clinical trials were followed for 30 days, with most finding relief. Side effects may include sleepiness, dizziness, and headache. It's expected to cost between $20,000 and $35,000. Dr. Tara Norella, CBS News, New York.